But when you talk about the human resource, is your county likely to hire more doctors or nurses or clinical officers to handle this third wave? Because that has been a major concern for Medixia in the country.
No, I think we should focus on what are the immediate areas that perhaps we need to do more, given the way the momentum of the surge. And the big area is oxygen. Now, remember that it's not just when the patient is in an ICU circumstance. Many patients, in fact, what they require is oxygen support. And you know, we provide it through piped oxygen to the bedside, but we also provide it through oxygen concentrators. We also provide it through cylinders. So if you are to ask me what myself and my health sector team consider as the areas that we are trying to grow, is more and more oxygen, particularly to lower level facilities, like say health centers. Because for many patients, it is actually oxygen support that is quite critical. Of course, the more the patient deteriorates and then they go into an HDU or ICU situation, then you need that kind of level of care. But remember, as Governor Ongwae explained to you, we all have already invested in ICU and in the staff capacity to run those ICUs. So I think we should focus on really just two big broad areas.
All right.
One is, let's grow our capacity to provide patients with oxygen support, including, as I said, at health center level. And secondly, let's go back to these questions of how do we reduce the speed of infection? And we do so by avoiding crowding. We do so by avoiding close contact. And even where people are in contact for whatever reason, reducing the time that they are in contact with one another.
In fact, Governor, I was about to ask you whether you think the country needs to go back to a lockdown, because that is the same thing that was echoed by the health chair for the National Assembly Health Committee, Sabina Chege.
Certainly. I mean, we haven't taken a position as the Council of Governors, but my own personal view is that we should discourage travel at this time. My own view is that we should continue with the curfew, maybe even make it slightly longer. We should remember why we are closing, clubs and restaurants at 9 is to reduce the amount of time that people are sitting together.
All right.
Now, if you go back to social gatherings, whether it is religious gatherings or funerals or weddings, we should reduce the number of people involved, as well as reduce the time that a function is allowed to continue, so as to reduce infection.
Right.
Also,
so, Governor,
being very, very stringent on the wearing of masks.
All right.
Personally, I was quite pleased to see the court in Nyeri being very, very stringent with persons who were prosecuted because of not wearing masks.
All right.
I think we have to be really strong.
All right. So, Governor Ongwae, it's good we're having this discussion with the county bosses here on KTNU Center this morning. And some of the people who have been flouting the COVID-19 rules are you politicians, because we've seen rallies, political rallies, which have been termed as the super spreaders for this third wave.
Well, let me go first, then Governor Ongwae. Well, if you recall, about almost 10 days ago, when we had a consultation with the head of state, and he made a very, very strong announcement to say everybody, including himself, and no more political rallies, and that was for everybody, including himself as the President of the Republic.
All right.
So we agree that some laxity had come into that area, but we took collective decision. The head of state was very, very emphatic, and you have seen that since that time, he himself has not had any large, engagements.
So Governor Ongwae, do you believe that politicians are also to take blame for this third wave because of the political rallies and the gatherings they've been holding?
I think, ma'am, it may not be prudent to only look at only one particular cadre of people. I think the politicians would probably take up the percentage of that. I wouldn't give it, but you really have to look at it broadly in a sense on the policy direction that we are taking as a country. Because even your questions this morning relate to clinical services, which means you are looking at a situation where somebody has actually gone to hospital, while the situation that we should be talking about is the preventive measures that we're putting in place.
All right.
On dilation, on war, and that is what you've just zeroed down on. Now, if you are looking at that, then you are looking at the broad measures that the first measures that we put in place as a country, whether it was sanitization, whether it was masking, whether it was social distancing, whether it was the administrative measures of curfew, and the other measures that we had put in place, I think we needed to go back to this.
All right. So let's talk about
seriously as a country. And I, to a certain extent, I agree with you on the politicians. And I attended that meeting with the president, and we all agreed that as politicians, we need to set the pace. We need to tell our people we need to stop what we're doing.
All right.
That I do agree with you, but I think that constitutes probably about 10 or 20% of the problem. The problem relates to ourselves as individuals, to you, me, and everybody as individuals in following the broad guidelines that were given by government.
So, Governor Ongwae, let's talk about the rollout of the vaccines within the counties, the uptake by the frontline workers, where the people were supposed to take the vaccine fast before any other Kenyan. How has it been in Kisii County? How many people have received the vaccine? And what is the plan to ensure that you convince the common mwananchi that this vaccine is safe?
Thank you very much. First, I would want to say nationally, we have as a vice chair, probably I'm privy to some of this data. The counties have received a total of 318,000 doses of this vaccine. As of 24th March 2021, we had a total of 67,421 persons that have been administered this vaccine in the counties. Of course, the priority category being the frontline health workers and then the uniformed forces and so on. It has been, to a certain extent, not as high as expected. I think all of us, whether you're talking about the fourth estate, whether you're talking about us politicians on both national and county, we need to ensure that we bring in very serious public participation, so that because this is you can't force anybody to take the vaccine.
All right.
For my own county, we have done. I will have to check the figures. But I think we've done about. We have done about 1,500 health workers have been vaccinated against a total of 4,500.
All right.
But I've given clear instructions that they talk to our health workers so that this number is increased. Probably by next week, we probably should have covered the 4,500 doses that we have.
All right. So, Governor, let me bring in Laikipia Governor Nderitu Mureithi. How many people have you so far vaccinated within Laikipia, and how has the uptake been, especially from the frontline workers?
I think the circumstance is the same. We've done about 2,600. We had expected to do 4,892. And remember, this is both public and private sector. So it's not just our medics; it's all medics across all institutions. As my colleague has explained, there's been a bit of apathy. Now, this apathy, we believe, started because of doubts that were created about the side effects of AstraZeneca. And these doubts were prevalent in some countries in Europe, Some countries then said they were pulling back from this vaccine. That was widely reported. Now, the good news, of course, is that those countries themselves have come back to embrace this vaccine.
All right.
And we think that the sample of 68,000 perhaps is large enough here countrywide to provide people with the confidence necessary.
All right.
You will recall in the beginning, because we were really very clear, we wanted to provide support to those who are most at risk. So we started with the medics. In hindsight, maybe we should have started also with leadership and other influencers who could have provided more confidence, but we have sought to recover. I think you've seen many governors take the vaccine publicly. I've done so myself and my spouse and so on, as a way of trying to provide confidence to our medics, to our police officers and the frontline staff. The conversation we had on Monday, Council of Governors and the Ministry of Health, is whether to merge the second phase into the first phase, so that out of these already existing over 300 doses, some specific categories like elderly people or people with already known underlying conditions could be then a part of the first wave of vaccines. And we continue as governors and leaders to promote the use of this vaccine. And encourage everybody to do so. We hope that before the week is out, the ministry and ourselves will have made the formal position so that we can extend the vaccination going on right now, not just to the frontline workers, but also to specific categories of those who are
On that note, I'd like to say Asante Sana, Laikipia Governor Nderitu Mureithi, talking to us about COVID-19 at the counties, telling us that they're well prepared, and the uptake of the vaccine at that county now stands at over 2,000. Also, thank you so much, the Vice Chair of the Council of Governors, who's also Kisii Governor, James Ongwae, talking to us about the uptake of the vaccines within the counties, saying that at least 64,000 people have already received the vaccine within the counties. Once again, gentlemen, Asanteni Sana. But then let's cross over to Eldoret, where Elvis Kosgei